Education points. What type of exercise is best for CRPS? Is ketamine coma more effective than high-dose ketamine?
All right, so today is July 19th, 2011, okay? And you're here for the 3-day ketamine treatment, okay?
Okay.
All right. And
It's
what
the
I...
18th.
Oh, is it the 18th?
It is.
Oh, thanks for correcting me on that. I got a little ahead of myself. All right. Now, let's go over your history just a little bit, okay? You were a pretty athletic girl before 2007. And then you had an injury involving that right shoulder area. Is that correct?
Yes.
To make a long story short on that whole issue, you ended up developing the complex regional pain syndrome. In trying to control that, you went on to have stellate ganglion blocks, I think 15 to 20 of those. Now, you did get some relief, but it wasn't long-lasting, correct?
Correct.
And so that hasn't been a permanent solution to your problem. Also, about 2 years ago, approximately, you started developing symptoms in that right lower extremity, okay? And again, you had, I think, it was 2 lumbar sympathetic blocks, got some relief, but it hasn't been long-lasting, okay?
Right.
Now, spinal cord stimulation has been discussed as a treatment option, right?
Yes.
And you decided to go forward with the ketamine infusion, and tell me why that is the option you've selected.
Because I'm having issues with my lower extremity and my upper extremity.
What's
so
that?
I'm having issues with both
Right.
lower and upper extremities.
Right, so that means you'd have to have wires, 2 wires placed, one for the upper, one for the lower.
Yes.
And it's more invasive, and especially when it comes to putting wires in for the upper, because it gets near your spinal cord, in your neck. And there's risk factors involved there, okay?
Okay.
So that was one of the major reasons that you decided to go ahead with this particular modality, the ketamine infusion, okay? Mm-hmm. Now, we discussed your situation as far as history. You were a good girl for a long time, then you became very naughty. You started smoking again, okay?
Okay.
And that's a risk factor, right?
Right.
Okay, all right. But Lisa over here is going to tell us that you were previously a very athletic girl prior to '07, is that right?
Yes.
Tell us about that.
Gym, if not daily, at least 3 to 4 times a day. Joined a bodybuilding contest. Always out and about with the kids, riding bikes and things like that.
So that means she kept those lungs in pretty good shape, lungs and heart.
Yes.
And I don't think she's lost all that just because she started smoking and all that bad stuff. But we needed to comment on that because you need to know that smoking is a pretty hazardous thing to do. Okay, now.
So I was walking downstairs apparently.
Well, I know you're joking. Okay, so you ready for some exercises?
Yes.
See where you are, baseline. You know the vertical finger test, take your left hand, do 2 vertical fingers in your mouth. Look, don't look at me, just keep looking straight ahead. All right, take your fingers out. Have you had any pain when you did that?
No.
Okay, next. Yeah, they're good, you're sitting straight, good girl, good girl. Now take that right hand, oh no, I'm sorry. Now take that right hand as if you're going to comb the back of your hair, please.
Oh.
Right.
Right. That's okay. All right. That's about it right there? Mm-hmm. Oh, okay, that's fine. Now point with the other hand where you had pain when you did it. Put your hand back up there. Point to where you had the pain. And describe it. Does it go down your arm, up your arm, or is it just localized? Goes down your arm?
And it's all in here.
All in there. Very good. Good job. Now do the same with your left. See if you have any problems with that. Okay? Very good. Good job. And the point here, Leslie, is you're still having that pain when I ask you to do that. It doesn't die off right away once you put your hand down, correct?
Correct.
Okay, very good. Now I want you to take that right hand out in front of you, please. Open and close it with your thumb as fast as you can. Atta girl. Good job. Good job. Now I want you to do the same thing with your left, please. See how much faster you are there? Good. Mm-hmm. Good job. Okay. Now we're going to take our attention down to your feet. And I want you to take your right foot off the ground and rotate your ankle as best you can. Atta girl. Good job. Now I want you to wiggle your toes for me. Can you do that? That's it. Good job. Hitchhike back to New Jersey. Good. Who's doing this over here? Somebody showing off?
Her.
Is that you?
No, I'm just helping her so she doesn't forget. She said I had to remind her.
All right. Okay. Rotate your ankle. Atta girl. Wiggle your toes. Now, do you notice how much easier it is for you to move that ankle? Did you notice that? Okay. All right. Now, the next thing I want you to do, Leslie, stand up in front of the door there. And I'm going to ask Lisa to stand by your better side, which will be your left side, please, for safety. And I want you to just take 3 steps toward me, please. And 3 steps back, please. Atta girl. Good job. Now, did you have any pain? Did we provoke any pain when you did that? No. Okay. Next thing is I want you to hold Lisa's hand for safety. Don't use her unless you need her, okay? All right. I want you to take 3 steps on your toes, please. Atta girl. Good job. Real tough on you, isn't it? Okay, go on back on your toes, please. And Lisa, hold her hand. Hold her hand for balance. Atta girl. Good job. Good job. Now, the question I have for you, did you have pain when you, did we provoke pain when we did that?
It's in my knee.
In your knee? Mostly in your knee? And did it get up into your upper leg, or is it just focused in your knee?
My whole leg hurts, but it's mostly in my
Did it get as high as your groin or your buttock, or does it limit?
it's in here.
Right in that, what we call the medial aspect, okay? It's where you got a muscle called the gracilis, okay? All right, now, next thing, by the way, did you have any pain at all on that left leg at all?
No.
Okay, excellent, good job. Now, this is a more challenging thing from a balancing standpoint. We're going to have to take 3 steps on your heels and 3 steps back, please. There you go. That's it, good job, good job. It takes more balance, we know that. Go on back, please. Okay, very good. Good job. Good job. Okay, Leslie, now did you have a different type of pain when you did that? Remember, it was more in your knee and your...
Yeah, it's all in the front.
It's on the front. Point to where that front is. Right in there? Okay, very good. Good job. What's more difficult for you, walking on your toes or your heels?
Heels.
Heels? Okay.
Lifting my foot up.
Okay, got it. Okay, please sit down. Oh, one more thing. I'm so sorry. I forgot. I forgot. This is a little bit more challenging. Okay, you ready for that? Now you can sit down. You can sit down because she's got to see what she's doing. You see that stretcher over there?
Yeah.
Okay. I want you to leap from where you are onto that stretcher. Can you do that?
No.
You can't? Well, we'll have to change that, won't we? Sit down.
Everyone's a comedian, eh? Must be in Florida.
No, we call that sick humor.
Oh yes. Well, hey, any kind of humor will be good. So.
Right, right. Okay, let's start with you over here. No, before we do, Lisa, you're going to watch that 12-minute video. We're going to make sure you can pull it up on your iPhone, okay?
Yes.
Before you leave today, okay? And that's important that you take a look at that. And if you have any questions about that, you're going to ask me questions. Now, do you have any questions about what we're going to do here?
No, I'm pretty filled in. I've been on your website.
Oh, do you? Okay,
Yes.
excellent, excellent, excellent. So tomorrow, after watching that 12-minute video, if you have any questions, please bring them up,
Yeah,
okay?
I'll have them all written down along
Yeah.
with my questions.
Yeah, okay. Sorry about putting you through the torture chamber here.
It is.
I know, I know.
It really is.
I know. Okay, now how about you, Lisa? Do you have any questions? Anything?
No, not until I watch the video.
Okay.
I'll be ready tomorrow.
You'll be ready?
Yes,
Okay.
I'm a planner.
Leslie, do you have any questions?
No.
You all set?
You know what? I do have a question.
Yeah, sure.
On the video, does it ask about food and items that we should give her afterwards, or will it cover all that in the video?
Well, that's a very good question. I'm going to tell you one thing. You've had, I think we covered this in our evaluation. You've had anesthesia before.
Yep.
And I believe you're not one of these that does a lot of nausea and vomiting with anesthetics, or are you?
You gave me the Zofran to take before.
I did? Okay, excellent.
Just to make sure.
You're gonna-
Normally I'm not,
Yeah.
but you said take 1 an hour before.
No, I know.
Or 2. I don't know what it said.
Okay, yeah. You can
I
take
didn't get
2.
it yet.
You can take 2, or you can take 3. Okay.
Okay.
Either one. So they should be 8-milligram tablets. So you're either going to take 16 or 24. Okay, milligrams. Okay. Got it. Okay. And that's just we just want patients to leave here comfortable. Okay. Now, if you have to develop a little queasiness during it, we can actually treat that as well. Okay. All right. Any questions? Okay. Very good. Now, okay. So one thing you brought to my attention, the fact that you can't really curl your toes up when you're standing, right?
Right.
So what I want you to do now, while you're standing, is I want you to, on the left side, I want you to curl your toes up for me. Curl them up. At it, girl. Now see if you can do that at all on the right side. Can you do that at all?
No.
Put the others down. Put them down. Now see if you can bring those up. Can't do it, can you?
No.
Okay. So we're going to check that when we're done. See if we can improve on
there's
that.
one other thing I can ask you to check.
What's that?
Alright. If I could take this arm,
Yep.
I can
Yep.
do that very easily. Like I have this range of motion.
Yep.
This side goes there. And
That's it.
That's it.
Okay. So we're going to check that when we're done. All right. So do that again on that side. We'll get that document. Okay. Up, down. Okay. Good. Now do this again over here. Got it up. Now you can't bring it down, can
No.
you? And does it cause you pain?
Yeah.
And what? Tell me. Point to where the pain is.
That's all in here.
Okay, got it. Okay, good. That's that's not good because that leads to Leslie,
Yeah.
listen. Lisa's going to ask you some questions, okay?
Okay.
Go ahead, Lisa. Ask her. Ask her.
me the 5 questions.
Yeah, just ask her one or two of the questions.
What's your father's name?
Alex.
What street did you grow up on?
Portland Road.
Okay. Now today is July 22nd, 2011, and you're on 200 milligrams of ketamine per hour, okay? Now listen, Leslie,
Yes.
can I ask you a question?
Yeah.
I just noticed that Lisa is wearing some tennis shoes, okay? Leslie,
Annoying.
Leslie,
Yeah.
can I ask you a question?
Yeah.
What did I notice about Lisa?
She's wearing tennis shoes.
Good girl, man. You are really a very expensive date. Do you know that? It takes a lot to knock you out. Did you know that?
Yeah.
Yeah. Listen, I want you to do one other thing for me. Put your head back for a minute, okay, girl?
No.
Yes, just for a minute. Just for a minute. Now listen, here's what I want you to do. I want you to look at my finger over there. You look up there. No, don't move your head, girl. Don't move your head. That's it. There. Now look at look up here at my finger. Look over there. Look up there. Can you look up there? That's it. Good, good, good. Now look over here. Look up here. That's it. Now look over here. Can you look over here? Good, good, good. All right. Now I have another question for you. Ready? Leslie,
Yeah.
show me the sign. All right, very good, good girl. Now, just so it's for the record here, she requires a pretty large dose to get the effect that we want. I think we got a good dose into her today, but we could even go higher on her if we wanted to. Do you follow that, Lisa?
Yes.
Because she's cognitively pretty intact. You know what I mean?
Yeah.
Yeah, she remembered what you were wearing.
Yeah.
Yeah. All right, very good.
She answered all the questions.
That's
perfectly.
right. That's right. Very good. And your vital signs have been extremely stable, okay? Very stable. Very stable. All right. Good girl.